we provided the abbreviated version of the interprofessional communication curriculum from the City of Hope, and this is led by Haley Buller and Betty Farrell. We presented a few of the domains, given that we had just a short period of time. We had to abbreviate a 3-day course into about 3 hours. I presented the physical aspects of care. This entire course is focused on the fact that people with serious illness need the benefits of strong communication skills from their providers, not just physicians, not just nurses, but from all of the healthcare professionals that are providing care. And what we've learned over time in providing these courses is that, in particular, nurses working with social workers, working with chaplains, learn so much from one another and through the experience of learning together that we look for those kinds of triads from different institutions. Yesterday at the ICCN, we were presenting to nurses to give them a sense of communication skills. And I presented the physical aspects. People who are experiencing serious illness have significant symptom burden. And although we all learn how to conduct a strong symptom assessment, it's with great, strong communication skills that we can do that exceptionally well. And we can do that not only addressing the specific symptoms that people experience, like pain or breathlessness, but we can also educate patients well and their family members. And we can do all of that with an empathic approach. So particularly in caring for people who are approaching death, there are a few changes in particular that occur in communication. We find that throughout the course of the illness, we provide a lot of knowledge and information so that people understand how to take their medications, how to approach their appointments, how to manage care and symptoms. Towards the end of life, we see that the amount of knowledge that we're providing to the patient actually tends to diminish, and it's more about emotional support and focusing on quality of life at the end of life. So that's one significant change. We're still providing education. It's just that the balance between education and support shifts. The same is true in terms of our audience. Throughout the course, we've been caring for patients and their loved ones. In the final hours, again, the shift changes. Instead of the patient being at the very core of all of this, they still are our focus. But now we're shifting more of our communication to the family members, helping them to be able to understand the dying process and provide the kind of support and care that their loved ones need during this really complicated and precious time.